Hi, this is Dr. Jean-Paul Romes over at Pocono Urgent Care. I wanted to give you a brief little information today about some news that hit the internet and the news agencies and newspapers this last week regarding the very popular drug azithromycin. Azithromycin is an antibiotic. It's a newer generation form of erythromycin, and it was created with the intent on being a longer acting drug, so you would only have to take it for 5 days, but it lasted in your system quite a bit longer than that. And it was a good, what we call a broad spectrum antibiotic, treating a multitude of bacterial ailments such as pneumonia, bacterial bronchitis, not viral, and certain skin infections, strep throat, etc. Unfortunately, as is the case for many antibiotics, azithromycin became exceedingly popular and is still being prescribed by many providers, be it physician or nurse practitioner or physician assistant. It's being prescribed for much more than the true indication, which is bacterial infection. Nowadays, it's prescribed for so many coughs and colds and runny nose, which are primarily all viral in nature. So it has become one of the most popularly prescribed antibiotics in the country, if not the world. So much so that the companies that produce it, have generated about almost $500 million in revenues in 2011 alone. The problem with azithromycin is that it does not treat most infections that you come up with on an average daily basis, such as the flu, coughs, runny nose, colds, or as some people call it, a sinus infection, which are primarily viral in nature, or bronchitis, which again are primarily viral in nature for most people. The FDA found, after reviewing a lot of the adverse effects of azithromycin specifically, that there was a slight increased risk of death from what we call arrhythmias, which are unusual heartbeats, be it irregular or very fast, that predispose people to die. So, and this is all traced back to an article that was published in the New England Journal of Medicine in May of last year, which cited an increased rate of death at about 47 for every million people prescribed azithromycin. They actually also found a similar rate of death for certain other stronger antibiotics prescribed commonly for other respiratory infections and other infections, such as Levaquin, which is another popularly prescribed antibiotic. These medications have been found to show increased risk of arrhythmias and death from that. So this sort of underscores the fact that most of the time we do not need antibiotics for our coughs, for our runny noses, for our flus, for our sinus infections, and for our bronchitises. The vast majority of times, these are viral in nature. So whenever you drop into the local clinic or family doctor or a walk-in clinic at a grocery store, you want to really make sure that when they're prescribing you antibiotics, do you really need it? And ask that provider, do I really need these antibiotics? If they don't give you a solid answer or a good informed answer, don't take those antibiotics. Go to your physician and have a good long talk. Do you need those antibiotics? Or come to Pocono Urgent Care. I'll be happy to tell you whether or not I think you need the antibiotics, because most of the time you don't. And in certain rare circumstances, yes, you do. But unfortunately, not all those unfortunately, all medications which we take, especially antibiotics, have the potential for bad side effects on people, including, as I've just discussed with you, death. And that tends not to be a very good option. So if you ever have any questions, come on into Pocono Urgent Care. I'm happy to answer them for you. And also, if you have any questions, you can also go to your doctor, and hopefully they'll be able to educate you on the idea of, do you need antibiotics or not? Because as we've discovered, they can hurt you in an irreversible way. So thank you very much for listening, and until next time, have a good day.